Okay, we are live and welcome. FYI committee. Chris, you're starting to look like
It's here by now.
My chair just went, thank you.
My brothers did it to his chair too.
Oh, well, the border senators were in here at lunchtime meeting with the Canadian councils. They adjusted some chairs.
Well, it's awesome.
Just FYI, there is Joint Fiscal has done a paper on how we fund school pensions. I think it will be released and on their website in the next day or so, if you are interested in reading that. And we'll have them come in at some point and talk to us. There's one other thing I wanted to talk to you about, but
The BAA? Or no?
no, that's moving it. They're trying to get it out of here so they can get started on the budget, which is the real big bill this year. So we are moving that along. So anyway, we're going to start with testimony today. This is Senate Finance. It is February 18th. No, today's the 19th. And we are today going to take up S51, which is an act relating to Vermont unpaid caregiver tax credit. We just had a brief introduction last week. And today we've got some witnesses. So first is make Okay, sorry.
No worries. I'm gonna be polite today, so.
Oh. Just welcome. This is starting to look like health and welfare.
I know.
It's the witness group. So welcome. This is Senate Finance. Do you know the senators in the room?
I do.
Okay. Yeah, I think this whole group's been in the building. May not have known the senators, but we've been around. Okay, so you know the routine. Welcome to Senate
Go for
Finance.
it. Thank you so much. For the record, my name is Meg Pulley. I'm the policy director for the Vermont chapter of the Alzheimer's Association, and I'm here to speak to the importance of S51, an act relating to the Vermont unpaid caregiver tax credit. The findings identified in section 1 in the bill as it was introduced last week are significant and powerful, and I'm here to share additional information specifically related to caring for family members with dementia. And would love to bring some of those folks in if you ever want to hear from them, but I was not able to manage that in 24-hour notice to get somebody ready.
Can I say I worked at an adult day? I did outreach, and we would frequently find candidates to go to adult day when the caregiver ended up being hospitalized with exhaustion. It was frequently a man who was going to do it on his own, and it is exhausting. And I've seen that firsthand. It's very, very hard work, especially when dementia patients tend to get their nights and days mixed up, and you stop getting a night's sleep. It becomes very exhausting very fast.
It definitely does, and I appreciate you recognizing that and helping me to tell that story, because that is part of the story, and I will bring some other statistics of questions that were raised when this was introduced last week as well. So according to the Vermont Department of Health, 1 in 4 caregivers in Vermont care for somebody with Alzheimer's disease, dementia, or another cognitive disorder. So about a quarter of, I think the number we heard last week was around 70,000, and those numbers seem to line up pretty well. And I will say I attached 3 very helpful briefs to this, and all of my quotes will be coming from, this one was put out by the Vermont Department of Health at the end of 2023, and it's sort of a snapshot of 4 different caregivers in Vermont and uses that to pull out some of the trends. One are our Vermont statistics, and then the final one, because we are, as an Alzheimer's Association, nationally working on the credit for caregiving bill at the national level with AARP. We also have one that's just specifically on the impacts of caregiving. And these are all national numbers in this one. So those 3 are attached to help me tell the story and give you a little bit of data to use. So just starting right out in 2020, which is the latest data that we have available through this system, Vermont had 12,800 people over the age of 65 who were diagnosed with Alzheimer's. It doesn't include people who are undiagnosed, other dementias, under 65 misdiagnosed. So we know that number is much greater when we're talking about how many Vermonters are living with some kind of a dementia. Caregivers for those living with Alzheimer's or other dementia play an essential role in maintaining the quality of life for their loved ones and helping them to remain independent in their homes and communities. It probably goes without saying, but that is much more cost effective for the families and for our city when that happens. The physical, emotional, and financial challenges they face in their caregiving roles cannot be overstated. Last year, 19,000 Vermonters provided 28 million hours of unpaid care to loved ones with dementia, and the value of this care is estimated to be $615 million. I understand that this bill is for caregivers, but as we heard, the financial impact of caregiving is often felt more acutely by women. Approximately 2/3 of caregivers are women, and over 1/3 of dementia caregivers are daughters. And so that shouldn't surprise you that a lot of dementia caregivers fall into the sandwich generation that you heard about, where they're trying to care for their parents and their children at the same time and getting squeezed from both of those angles. Dementia causes prolonged and a devastating toll on caregivers, as you've heard. 1 in 3 dementia caregivers have been so for 5 years or longer. As dementia progresses, caregiving duties may be needed 24 hours a day. Sometimes Alzheimer's lasts up to 20 years. So with this demand amping up over 20 years, you might be fine at year 5, but by the time you get to year 12 or 13 on lack of sleep and lack of support, it gets pretty significant. The additional demands of caring for someone with dementia impact a caregiver's ability to work. And while 6 in 10 caregivers were employed last year, 57% had to go in late or leave early to meet caregiving demand, and 18% went from full-time to part-time work, and 9% gave up work completely to fulfill their caregiving responsibilities. And I know as a female taking care of my own kids, some of those people are foregoing opportunities to rise in their employment opportunities to pass up a promotion because they know they won't be able to manage that. And I just think it's important to recognize that those kinds of decisions in your highest paying years of your life result in financial security as you age, and sometimes multi-generationally, because you have nothing for your children or to leave behind, a house, etc. So as a result of this financial strain, many families significantly cut back on savings, contributions, and other spending. Nearly 40% of caregivers reported the food they purchased often ran out before they could receive more, and 30% shared that they had to eat less due to the cost of caregiving. Alzheimer's disease takes a devastating toll on caregivers, and there is an urgent need to alleviate the overwhelming financial burden. So I just wanted to speak to a couple parts in the bill specifically. One is that it's a refundable credit, and I think that is really important when looking at least dementia caregivers in that demographic. 41% of dementia caregivers have a household income of $50,000 or less. So there's a lot of people that may not be receiving a tax refund to use the credit towards. And we often hear, and you may have heard, reports from people who spend down to access services. So they don't qualify until they spend enough of their funding. So they're driving themselves into less financial security. Related to the first number, you had asked questions about, how would we know caregivers are related by blood? We do have data that shows that 51% of caregivers in Vermont cared for a parent-in-law, a partner, or a spouse. So just to give you an idea, I don't know who the other people are caring for. Probably a child fills a big part of that, or a neighbor or friend, maybe. And then there was a question about, how would we know about the needs if someone has a need? And we do have a system that we use here in Vermont and many many states called the Activities of Daily Living, ADL. You're probably familiar with it from Adult Days, but that's what's regularly used to help determine how much assistance a person needs in order to remain either living in their home or even if they're in a residential care facility. So I think there's a system that could be woven into
Once you
this.
hit 65, Medicare has them ask you basically ADLs when you go in
Yeah.
for a doctor's visit.
Exactly. So I would think you'd be able to find a way to link that. And then the part on requiring a diagnosis, it makes sense. I support that. We just want to be sure that we are kind of paying attention to the timelines of diagnosis and that we don't get to a stage where caregivers are really doing a lot of caregiving and they can't access this because they can't access diagnosis. And I'm working closely, many people are working closely in trying to improve the ability for primary care docs around the state to diagnose and only have them sending the more complicated and acute cases to, for instance, the UVM Memory Center or Dartmouth or the Bennington Memory Clinic. But I do think that it's important for us to think about that. We are back to more than 500 people on the wait list at the UVM Memory Center right now, which is a number that we had really proudly climbed down from into the mid 300s, and it's crept back up. So that just to bear in mind that could have an impact with this demographic. Compared with caregivers of people without dementia, and I know this is for all caregivers, but I just want to articulate that twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties, and they do expend significantly more of their own income in caring for someone with dementia. The total lifetime cost of care for one person living with dementia is estimated at about $400,000 in 2023 dollars. And 70% of this is borne by families, either through out-of-pocket costs or long-term care expenses or from the value of the care. So I really appreciate you considering this valuable financial relief tool for Vermont caregivers. And I'd be happy to answer any other questions that you have or provide you with additional data if I can.
Thank you. Meg, thank you so much for your testimony. I'm curious, I'm looking at the bill, the line 11 and 12 on page 3. I don't know if you have in front of you, the activities of daily living.
Yeah.
And I think your suggestion about sort of linking it to ADLs is a really good one. I know the TAC department, when they come testify, it's going to be really focused on how do we define this? How can we
Well,
figure
the
it
number
out?
70,000 caregivers makes the money people a little nervous because to do this tax credit for 70,000 people would probably put some big holes in the budget.
Well, I think it's not just about the money, although obviously it's partly that, but also just how can they administer it regardless of how much it costs, how can it be administered? And so I would be interested if you had some specific language about how we could connect it or maybe we can talk to, legislative council who drafts in this area to figure out a way to connect it directly, because then that would be something that's like a known. I think your suggestion's great. So if you have.
I don't do that. I know the area agencies on aging or the SASH nurses, those are the people that do the evaluations that I'm aware of. I'm sure doctors' offices do it as well. So I think it would be a matter of figuring out where those numbers come from. I'm just thinking of people that I know that go through the area agency on aging, for instance, to be referred to or suggested to go to an adult day, right? They're looking at this information, and I would imagine that they could provide the same kind of documentation that they provide to the caregiver to say, you scored a 2 on this, and anything above a 3 means that you can't be left alone.
Right.
Like that kind of piece. And they did want to provide the information about the percentage that we know of people who are caring for somebody that's related by blood or marriage as one way to kind of draw the number potentially down. And then to also articulate that I think there's ways to look at that number and see how many of those are people caring for children and what other access to care relief they have, like a child tax credit that they may be already getting. And maybe there's a way that you can parse that number to look at, if you're caring for a child, you have this, but this is the equivalent for people caring for an adult dependent with disabilities or because of an accident.
But I just 1,250, and I think the number in the bill may be higher, times 70,000 is $87,500,000.
I don't have that right now.
Neither do we, so we'll.
Yeah, I don't, it wouldn't be that much. I mean, there's,
we'll
yeah,
have to-
so
But it'll have to be a lot less.
we can certainly narrow it. And I think getting that kind of information is helpful to figuring out how to define it narrowly enough, but not so narrow that nobody qualifies for it.
It's better to start at the highest need.
Yep.
And help that, and then perhaps move it forward when.
Exactly, and when you had mentioned that it was set to follow the child tax credit, which I think is important, but family caregivers often are in a kind of a different financial situation than a family that's starting off or has young children, and I wanted to mention that less than 50,000 number, just to give you an idea of, you know, you could change that amount maybe if you wanted to try and focus it more on people that are really running out of resources and having devastating impacts on themselves. And I would say there's a lot of data that I've presented in other committees around like the negative health impacts on caregiving. And I think if there's anything that can be done to abate that, so those folks don't end up with chronic health diseases themselves, it's also a really important value to a program like this.
Yes.
Thank you.
Carrie is in the Zoom. She just has to have a Zoom. Thank you very much. Thank you.
Thanks.
And Carrie Brown is here. Hi, Carrie.
Hello, everybody. Hi, I'm Carrie Brown. I'm the Executive Director of the Vermont Commission on Women. Glad to be here today. I really appreciate your taking this bill up, and I want to give you just kind of give you a little bit of our perspective on it. But just as by way of introduction, the Vermont Commission on Women is an independent state agency. Our mission is to advance rights and opportunities for women and girls in Vermont. And we do that through acting as advisor and information source for the legislative and executive branches. We also do public education. We conduct research. We provide referrals to folks in the community. And we just, try to make sure that people know what their rights are and can access the resources that they need. We've been around since 1964, and we have a collection of policy statements that we use to guide our work. And these are adopted by the full commission, and they're periodically reviewed and updated. And the one policy statement that guides my testimony today is one that has stood since 2001. And while some of the details may need to be updated at some point, in its essence, it's really just as true now as it was 24, almost a quarter of a century ago. And so I'll just read that to you in part. The Vermont Commission on Women supports legislation, policies, programs, and initiatives that provide support of family caregivers, promote alternative care situations, support long-term financial planning, and support reform of Medicare to focus on preventative services rather than loss of health in order to address the growing care needs of our aging population. So this is something that has really been on our radar for quite a while. Many of you may have heard us speak about the gender wage gap. That's a pretty common term that gets tossed around, which is this idea that overall, when you look at how much money women earn compared to how much money men earn, and you kind of average it all out, men are making more money than women are making. And there are multiple intersecting factors that cause this. Some of it is due to plain old discrimination, but very little actually. Much more of it is due to the fact that women are disproportionately called on to shoulder unpaid family caregiving responsibilities that interfere with their full earning potential. So there's an economist named Claudia Golden who recently won the Nobel Prize, and she specializes in a lot of this work. And she just talks about the impact on the wage gap of something she terms greedy work, which is the idea that, especially at the higher end of things, higher income end of things, that people who put in overtime or weekend time or evening time end up earning more. And, it's not just because they're in higher paid jobs, it's because they have the opportunity to advance, they have the time to put into that work, and that is more often that's men, because more often it's women who are doing the caregiving work at home that is keeping them from doing that. So women are globally, women spend over 3 times as much time as men on unpaid care work. In the US, a recent survey found that 1 in 3 caregivers have been unable to save for emergencies and unable to save for retirement because of their caregiving responsibilities. And women in this country are 3 times as likely as men to retire early so they can provide care for a family member. And women are much more likely to work part-time than men are. And that really affects the overall ratio of women's earnings to men. So a lot of times you will hear people talk about the wage gap as the ratio of women's to men's earning as being around 90% or so in Vermont. It's kind of hovered around there for a while, but that is only if you look at full-time employees and you're comparing full-time employees to other full-time employees. But if you look at all employees, which includes part-time, the most recent statistics from the Vermont Department of Labor show that women are 50% of the workforce in Vermont, but their earnings are only 75% that of men. And this really has everything to do with the fact that so many more women are working part-time, so they're just earning less. And so they may be, then they're doing this almost, much more likely to do this, to be taking care of family members than men are to do so. And so this has a huge impact on people's individual financial situations, but it also has an impact on our economy as a whole. Our economy really relies on people providing unpaid caregiving labor in order to be able to function. And globally, this is true all over the world. The economic value of unpaid care work is about $11 trillion, and women's share of that is about 8 trillion. So 8 out of 11. And then in the US, in 2024, a recent estimate put the economic value of unpaid care as $1 trillion, with women accounting for 2/3 of that. So that is work that someone would need to be paid to do if folks weren't doing it unpaid. And so that's part of why we have this huge impact on our economy, and why we are all, to some degree, kind of dependent on people doing this kind of work. And so this tax credit is not a way to replace lost wages that women or anybody is losing from taking care of family members, but it still is a very important step in recognizing the value that unpaid care work brings to our whole economy. And it's a valuable tool for acknowledging the undue financial impact that this work has on people who are often the least able to afford it. And Meg spoke to that very well, that you often see folks who are the sandwich generation idea of women who are caring for children and their aging parents at the same time. I can't tell you how many people I know who've been in that situation, including myself. And so you're really being squashed at the time when you're potentially thinking about how to advance your own earnings or save for retirement, and really stuck not being able to do that. And then for people who are at the lower end of the income scale, who are missing out on work opportunities that are not as well paid to begin with, and then they're losing wages to that, it can have a huge impact. And so while $2,500 doesn't seem like a whole lot, it's enough that it can actually make a difference for people who are at that end of the pay scale. And I also, you will find out the numbers and of how many people this impacts and how much they would get for the credit. And I don't know what those are, but I would say that if the standard is 20 hours a week for a year of caring for somebody unpaid, there are many people will not meet that standard. I don't think it's going to be a very large number of people who would qualify for that full 2,500, and maybe not even for half of it. I don't know, because so much of it is done sort of around the edges. But for those who are doing that work and are really putting in that significant amount of time, this is a great way to recognize that and acknowledge it, and to say, that your time is worth something. This is having an economic impact on you. It's helpful to the rest of us that you're providing this unpaid care work. And so we want to do what we can to support it. So I'm happy to answer questions or provide any additional information if you'd like.
Committee, any questions?
Is your testimony on, have you written it out, Karen?
Yes,
It is on our website.
Yes.
Okay.
It's on your
Thank
website. Yeah.
Thank you.
Okay. Any other questions? Okay, thank you, Carrie.
Thank you.
All right, and now with Colin Killard. If all 70,000 people get the full credit, the bill is $175 million. So, we could house the homeless for 175.
I don't think it's that many people though.
Yeah, we're gonna have to
Really
narrow it down, and that's the question. Can we narrow it down? And can the tax department narrow, does AARP?
Well, I think
Yes.
that Carrie's point that she just made, that most unpaid caregivers are not doing 20 hours a week.
But the question is, how does that, how do we get an estimate so we know what we're budgeting for? B, how does the tax department know? So when a tax credit is claimed, we're gonna have to find some numbers. Because I think it's safe to say we don't have $175 million. If we did, we could buy the property tax down to zero. So, welcome, Colin, and hopefully you might be able to help us.
Thank you, Chair Cummings. Yes, I hope to illuminate a little bit on that 70,000 number. For the record, Colin Hilliard, I'm the District Director of AARP Vermont. Thank you for the opportunity to testify today and for spending time on this really important issue. AARP is a nonpartisan social mission organization with an age of 50 plus membership of over 38 million nationwide and 100,000 members here in Vermont. We're supportive of S51. Generally, we're supportive of efforts federally and in the states to provide tax credits and other financial assistance, or both to caregivers. I'll talk kind of just generally about some family caregiving nationally and some data we have around that, and then drill down into the state numbers. Family caregivers, you know, they put family first. They help with everything from medications, medical care, meals, bathing, dressing, chores, finances, transportation, so much more. They spend around 20 hours a week on average nationally. So you figure, you know, you would have half of folks would fall below that 20-hour threshold. Critically, they save taxpayers money with keeping folks, you know, out of costing their nursing homes. That's paid by the states. And then some of the financial challenges these folks are experiencing. More than 3 in 4 family caregivers use their own money. They spend about $7,200 a year on their own out of pocket to care for older family members. Many spend their personal savings, tap into retirement, incur medical debt themselves. Nearly 1 in 5 caregivers said money or cost was their biggest challenge as a caregiver, and more than 55% of family caregivers feel financially strained. And also, as it relates to the workforce, I think that's a really critical element here. Many have had to cut down on their work hours or quit jobs because of their caregiving responsibilities. 61% of caregivers were employed at some point in the past year while also caregiving. And then I wanted to drill down into that, the 70,000. This comes from an AARP Public Policy Institute study in 2023 called Valuing the Invalidated. 70,000 caregivers in Vermont provide 66 million care hours. We estimate the economic value of that caregiving at $1.23 billion a year. And the methodology for that number is based on a weighted average of 4 data sources. It's an AP poll, Bureau of Labor Statistics, CDC numbers, and there's one more poll that I'm forgetting the name of right now. And the survey had each of those surveys had a different definition term for caregiving. So the survey adjusted that data to meet a common definitions of a caregiver aged 18 plus, a care recipient aged 18 plus, and critically the types of care. So anyone providing assistance with activities of daily living, that's the bathing and dressing, etc. Also instrumental activities of daily care. So that's the managing finances and transportation, and others, and also medical and nursing tasks. The economic value portion of that was estimated at the state level and an average of the state minimum wage, median home health aide wage, and the median private pay cost of hiring a home health aide. I'm happy to dive into that anymore as best I can. As it just kind of to sum it up here as it relates to the bill, we agree that the refundable credit is a really important part here. Also, we just heard a question during Meg's testimony about defining ADL and how we can do that. ARP has worked on some of these issues in other states and would be happy to share some examples of ways that we've seen that lined out that we think can work and really prioritize folks and define it in the legislation.
Does any other state offer a similar tax credit?
This bill is a little bit unique in that most other states do it based on the out-of-pocket expenses, tax credit for the out-of-pocket expenses. That's how Oklahoma is, I believe, Nebraska as well. There's, I think, around over 20 states that do a tax credit that are some way tied to the out-of-pocket.
Yeah, and most of those, because they're high too expensive, require itemization. And that would make it so a lot of people wouldn't be eligible for it because so many taxpayers don't itemize, especially people in the low.
Okay. Senator Chairman, I saw your hand. Okay. So you haven't gotten any statistics that are going to help us whittle down the 70,000.
I can say that the that 70,000 number isn't tied directly to immediate family caregiving, right? So I think that's an important part.
Okay.
Also, the average of 20 hours, I think, is an important thing to note, right? So not everyone will meet that, as Carrie mentioned. Also, that number, the 70,000, includes that instrumental activities of daily living, the managing finances, the transportation, which, if you were defining the just the activities of daily living, the providing assistance with those, that would be a little bit different definition. So it would be covered.
Okay. Because some of these families have visiting nurses that will come in and help, like every couple of days with bathing, and there's probably as many different arrangements as there are families. And so I'm trying to figure out a way we can afford to do this.
This is a very noble bill, worthwhile bill, and I'd love to do something like this. I'm hopelessly realistic, and 170 million just doesn't seem at all feasible. So I welcome thoughts from the advocates how to narrow this down to something that's comparable to what other states have done, that would offer some form of relief and recognition, but doesn't carry a price tag of $175 million. That's what I would say.
So I think that's not the right number. So
That's those are the numbers we've got. So where do we get?
well, so they're not actually, I mean, JFO has a much lower number than that, but that they haven't brought out yet. But part of it is you have to, the tax credit ramps down. So, and it also is based on full-time equivalencies. So the 2,500 is for full-time. And then also there's the 70,000 caregivers. Some of those are caring for kids. Some of them are not caring for people 20 hours a week. So there's also that. And then there probably are some people that are above the income limits. So there are ways to and also some of those might be just doing it for a few weeks instead of like full-time. So there are certainly ways to narrow the bill more, and I'm happy to do that, to work on that.
Under the 75 million, we could really set up a good adult day system.
I don't think that's how much this costs, though.
No,
Close to it.
that is the ultimate. That's, everybody in that number gets the full amount. But adult days really do provide respite for families so that a person with dementia can go. There's a nurse, they get medically monitored. They have activities, they get to socialize. They get really tired and get sent home to eat their dinner and go to sleep, hopefully, unless they do tend to wander at night. But at least the caregiver can sleep during the day. So, right, Randy, you're.
I just think that there are better ways to come up with a more accurate number.
Yeah.
Among the numbers, there some states do have a better number. Our last number that I actually saw where there was theoretically a measurement was in 2012. And at that point, there were 34 million hours of unpaid care in Vermont. And where that number comes from, I haven't a clue. But I think we can narrow the number down better and get something that's perhaps usable. I mean, it's clear, there's no question that the amount of labor provided by family members to care for people keeps people out of institutions. I mean, and one of the things that's also taking into account is the savings that we get from having those people do that. Those savings are very significant.
Yeah, most of those people would.
So again, Ruth, I'm happy to work with you to try to get some numbers.
Yeah, that would
you're
be
comfortable with.
great, Senator. And I also think, obviously I totally support our adult days. I love our adult days. My mom went to one,
Ours has
awesome.
back yet.
And I think this is sort of complementary to the work that they do because people are going to adult days for 2-3 days a week. And then they're getting cared for by their family members for the rest of the week. And so it's sort of like they work in conjunction with each other. And so I absolutely can work with Senator Brock and others to narrow the numbers. And also, to work with JFO on getting the data that they need.
Okay, do we have any further questions for Colby?
Thank you.
Okay, thank you. Patrick, you're not on the agenda. Is there anything you could share with us at this point? Sure. All right. Any thoughts? I know you've been working on this, so.
Yeah, so Pat Dickerson, the fiscal office. I think there's been a few things that have been said that I think help sort of contextualize that 70,000 figure. First of all, and what's most difficult for me right now is the 20 hours. So it's not something that's tracked. We have the 70,066 million hours, but the distribution of those hours are going to vary pretty significantly. On one end, you could have someone reporting an hour and they count, right? But on the other end, it's someone's full-time job. So just because someone's doing 40 or 60 hours a week doesn't entitle them to a higher credit. There's a max. But on the lower ends, they don't qualify. They don't hit that threshold. One of the other challenges with that 20 for me, and I think for the tax department, is it's a self-attestation. And I'm not quite sure what mechanism there is to sort of audit that kind of mechanism for determining eligibility. So, when it's self-reported like that, what's to say you don't round up a little, or as long as you're close, it's defensible, right? It is sort of the average amount, and it is a self-attestation. Our tax system is built on voluntary compliance. That's why we don't have 1,000 auditors over at the tax department. They really focus on customer service. But one thing that I did talk about when I was here to sort of maybe hone in the scope a little, we have sort of the experience from Canada, which showed a 5-ish% uptake rate among income eligible households. If we sort of equate that to the Vermont tax returns that are within the income range of this bill, that's it goes from about 14.4. Just saying if I have that up in front of me. I do. Okay, so there's roughly like 300,000 income eligible tax returns in Vermont residents. And if we just apply that one take-up rate to those income eligible households, that's about 14,000 tax returns that if they have the similar take-up rate would be eligible. So, I mean, I just want to bring that up when comparing the 70,000 caregivers compared to the number of tax returns that we're actually talking about when we look at the Vermont distribution here. So it does cover like almost 90% of state taxpayers. But the biggest thing here is with the hours and seeing sort of both the compliance with reporting and also how many people actually do hit that threshold.
Of course, Canada has a much more generous paid family leave than we do. It has the unemployment. There are other supports in Canada. So
Free healthcare.
yeah, you may see that our take-up rate would be higher because we don't have a family leave. We also don't have a 50% income tax. So, but there are benefits that do fall under that. So maybe, Dr. Hardy, you could kind of talk with Joint Fiscal and the tax department and see if we can find a way. Maybe we limit it to 20 or 40 hours a week. Start with full-time caregivers, which are people that are seriously into Alzheimer's or other. We have all those parents who've been in looking for supportive housing for their adult children, and the parents are aging out on their ability to care for them. But there are parents that are caring for disabled children 24/7. Maybe if we could figure out the 40-hour, the full-time equivalent.
Well, a couple things I wanted to, one, this, as I mentioned, when I introduced the bill to everyone, this is based on the same income range as the child tax credit, which goes up to 175,000. So, I mean, one way to narrow it is to narrow it down so it doesn't hit as much high income. And then I'm happy to work with Patrick and Jay and the tax department or whomever to narrow it. Rebecca Samaroff is coming in tomorrow, I believe, right? Or Friday. She's coming Friday. So do you want me to do that before Friday or after?
No, we'll talk to her on Friday. Yeah.
Yeah. So I figured she might have some suggestions. I do know that in one thing she mentioned to me is like tying it to the potential federal bill, but I don't know, waiting for a federal bill to pass might take forever. So I don't know if we want to do that.
Especially when it's tax credit for poor people.
Yeah, so, but I can
see what we just see if there's something.
Okay, and I think also
would make this doable.
Idea of the ADL stuff is really a good thing too, because that would narrow if it's only for people who need assistance with activities of daily living, and that is defined. So, and that could be part of the sort of verification with the sort of doctor's note thing.
Or adult daycares do a screening with ADL.
Yeah.
Now I think Medicare has all primary care. Before I can go see my doctor, I used to give those tests.
Yeah.
Can you get up and get yourself dressed? Yeah. So those are fairly widely available. And there's also a scoring mechanism on.
Yeah.
So
So I mean, I can certainly next week come in with a narrower draft after we've gotten testimony this week, if that would be okay.
Yeah,
Okay,
that would be helpful.
okay, and Senator Brock, let's chat too.
That's right.
Okay, thanks.
You're on the Alzheimer's board, right? You're on the Alzheimer's Association board,
Well, sort of in and out
sort of in and out, okay.
for many years.
I forget, you've been into health and welfare with that bill. Okay. Think that's it. Thank you. Committee, we've got 15 minutes until we're going to change direction a little bit, and we're going back to state aid for school construction. Be Michael Gone. Thanks, Bond Bank will be zooming in, so be back. Thank you.